Welcome everyone to our webinar. So this is our first webinar to AAAPC Early Career Research Team. And I would start by acknowledging the traditional owners of the country where we are standing today. And I pay respect to the elders past, present, and emerging. So today we have got our guest, Dr. Olayide Ogunsiji. She is a senior lecturer and director of academic workforce at the School of Nursing and Midwifery at Western Sydney University. Prior to her migration to Australia in 1999, she had a BSc and MSc in sociology, and she was an associate lecturer at the Ogun State University in Nigeria. So thanks very much for migrating to Australia, Olayide. And she's a registered nurse here. And she has worked in different sectors in the nursing area, including cardiology, surgery, and mental health. Dr. Ogunsiji joined as an academic staff of Western Sydney University in 2008, and she was awarded a PhD in 2009. Since her PhD, Olayide has been initiating and leading multidisciplinary teams in developing and conducting research in areas of women health. She has focused on migrant and refugee women health and also African women's health with interest in female genital mutilation, intimate partner violence, breast and cervical cancer screening, practices and experiences of nursing workforce in refugee health. She has been successful in obtaining internal competitive Western Sydney University research grants and New South Wales government research funding. She was successful in government funding in collaborated in developing a community partnership project that aimed at raising cancer screening awareness among African and Chinese migrant women in Sydney, in Australia. She has presented her work in international, national, and local conferences, and many of those were published in high impact journals. Her work on female genital mutilation has received attention through media, including ABC, SBS Radio, and also SBS Online. Olayide is a senior fellow higher education advanced and has been teaching all levels of undergrad nursing students, postgraduate, and also higher degree research students. She is passionate about primary prevention of health issues and advocates the importance of paying attention to social determinants of health as the way to addressing several health issues. She is currently supervising two nursing honors and multiple master students and one PhD student. So she's the founder of African Women's Health and Support Organization, and this is a non-profit organization for promotion of African women's health at home and abroad. She is the chair of a management board of Blacktown Women's and Girls Health Center that is situated at Blacktown. Olayide is a multiple award winner as well, and she received Dorothy Garrigus Adams in 2021 award for excellence in service of Sigma Theta Theo International Honor Society International Awards, and also she received Western Sydney University 2020 Vice Chancellor Excellence Award for University Engagement and Sustainability. So I think that's enough introduction. Olayide, do you want to start?
Thank you so much, Habiba, for that, an introduction. Good afternoon to everyone, and thank you for thinking of me. I would like to thank Associate Professor Leah East, who we have known each other for a number of years now. I can still remember when we were in that room preparing for our PhD and all the rest. So I really thank you, Leah, for tapping me on the shoulder, and I thank each and every one of you here for making it to this webinar this afternoon. I join Abiba in acknowledging the traditional owners of the land on which we are all sitting or standing at this particular moment, and appreciate them for all the elders, past and present. The good thing about the introduction that Habiba has read is that it saved me a lot of other things that I will need to say in the course of the webinar this afternoon. I understand it's pretty much informal, and when I was going through actually what you would like me to talk about, I could sense that it's informal, is to talk about, my journey and what has really worked and what has not worked. So most of the things that you'll be seeing is really, just what it is about me. And I will start sharing my screen. I was thinking, I said, okay, in also what I need to do, they are saying, okay, they're looking for a woman from a Carl background who could talk to us on this, on this platform. So I just gave the title. I was reflecting, and I said, okay, let me look at being a woman, a mother, and an academic in a new country. So I consider it as an untold stories of culturally and linguistically diverse women in academia. So I'll be looking at, how myself as a woman, myself as a mother, and, how did I navigate the academia to be where I am today. Like I said, a lot of the things that Abiba has already read out in my introduction will be part of what I will just, glance through or just brush through without much details by the time I'm making my presentation. I actually migrated to Australia in 1999. I came with 3 children. These are my 2 daughters, and this younger boy was my son. He's my son, and this is their cousin. So these photos were taken in Nigeria. I migrated from Nigeria in 1999, Nigeria, West Africa in 1999. Their cousin is not here with them, but we were all living together then. So I migrated to Australia with my two daughters and 1 son. The elder daughter was 7 when I migrated here, and the younger one following her was 5, and the little boy was 3. And just like what has been read in my introduction, I was already an academic staff in one of the universities in Nigeria. But lo and behold, I came to Australia actually not knowing what to expect and what it will be like. So I see myself in Australia as beginning again. One thing I knew then was that I wanted to remain in the academics, but how the experience and what I knew in Nigeria would translate to that of Australia was what I did not know. I could not read that on the pages of any textbook. I was not able to find anybody even to talk me through at the initial stage on how to get there. As a matter of fact, in terms of getting to do anything, and a number of us here will be able to relate to that, especially if you find yourself like me, migrating to Australia as an adult with 3 young children, without family, except no extended family, just my 3 young children, my husband and I here. No other person, I did not know anybody. And of course, it's a different ball game if I had to have been born here or to have grown here. But I actually migrated as a full-blown adult. I was 37 when I migrated to Australia. So, and as a matter of fact, it's my first time of traveling out of Nigeria to an overseas country. So I did not know how to get there. I think I started by looking for opportunity to apply to one of the universities, but it didn't even get to anywhere because which universities were there and all the rest. But the determination was there that I want to be in the academics, get back there. And I could remember several instances from colleagues from back in Nigeria asking me for which university I was lecturing in Australia. But of course, I was far from being in any university as an academic. However, I thought of, okay, if I cannot get job in the university or job anywhere, I was applying everywhere, even to childcare center and to everywhere. As a cleaner, as whatever, you can just think about it. But there was nowhere I could get, the way around that. So the good thing though was that I migrated on the 27th of November, to be specific, to Australia. And that was about the week that that time it was UAC, of course, application to enter university, or I think it was the last week of all the weeks. They've had it open for people that wanted to apply to the university. They've had extension, they've had additional extension, and I think it was extension of all extension. That was the end of it. So I quickly, that particular week, which was the second week of my getting to Australia, I said, I don't think I'm patient enough to start, marking around, looking for a job that nobody seemed to be, nobody seemed to really look at my side in terms of employment or whatever. So I quickly put in an application to start nursing in Western Sydney University. And that was how the whole journey started in Australia. I consider it as a journey of courage. This is myself and the 3 children that I showed you initially. I consider it as a journey of courage. Courage in the sense that, how will I tell my colleagues back in Nigeria that I'm not at the level that I left Nigeria in the university? Given the fact that that was a place whereby an average individual would think that I've arrived by, crossing the seas to come to Australia. They would think that I've already reached a kind of accomplished milestone. But how will I tell them that I'm nowhere in that space of their mind? So it was a journey of courage. How do I sum up courage to go back to the classroom as an undergraduate student in nursing, new discipline, starting again, and not even as a master's level, not even as a PhD student, but as an undergraduate student. I saw it as a journey of determination. A journey of determination in the sense that I had a lot of discouragement, even from people that I just maybe casually told what what my interests were. There were discouragements in terms of, if you go now to the university, you start now as maybe 37, 38-year-old woman, to start nursing again from the beginning. How will you even be able to enjoy the training when you finish the Bachelor of Nursing? But I was determined that it doesn't matter, even if it is to whatever the number of years, no matter how old I was in the class, I was ready to go for it. It was a journey of focus. Focus in terms of, this is what I want and nothing but that. And so I don't know whether there are some here, because I know I have an idea of the audience that may be here, different level of academics. But that is my journey. And this particular photo that I'm showing, you could see my children were happy, they were smiling, they were laughing, but you could see that there was no excitement on my face. But there was the issue of what does the future actually hold for me. That was a time whereby just by sheer luck, I got somebody that I just spoke to that, and she said, oh, in my place of work, I'm an assistant in nursing. Would you like to, work as one of the assistants in nursing? That day, she gave me one of her uniform and I went. You could see on my face fatigue. You could see on my face tiredness, because those were the time that all I could do was night shifts, come back home, look after the children, and then study. So as a mother, as a woman, it was a lot of struggle, all because of the journey that I determined to embark on, journey of courage, determination, and of focus. And like I said, I came to Australia only with just my family. So at the time I started, I only had these people that you can see journey with. I only had my husband and the 3 children, who every one of us, we were all struggling to get our head around what Australia was like. The children had a lot of difficulties in settling down. And with my struggle as well, the children will come home and tell me about their ordeal. And I was wondering who would be able to help who. But we were only able to take courage in one another. But like I said, it all started with Western Sydney University in the year 2000, where I started my Bachelor of Nursing. And I completed that in 2002, before I then went on to complete Bachelor of Nursing Honors 1 year, still in Western Sydney University, and progressed to PhD in which I completed in 2009. And I joined the academic staff of Western Sydney University in 2008. It was in the course of doing my Bachelor of Nursing that I started gaining a kind of a glimpse into what the journey will look like, or how I would get into the academia. And what happened was that, I believe one of the academic staff then, she did not know who the student, she did not know what was going on in the mind of the student she was standing in front of anyway. But she just mentioned it in the class casually that time. She said, Western Sydney University is advertising for summer scholars. Those that would like to, that time it was Winter Scholar. We have a program in Western Sydney University whereby students can work with researchers on their project, and the university will pay them during one of the breaks. That time it was during inter-semester break between autumn and summer and spring semester. So she said, oh, the university is advertising for winter scholars, researchers in the university who will want somebody to work on their project. Oh my goodness, that brought a kind of a light to me that, oh, this is something I would like to do. I would like to be part of a research. That is my area of interest. And some of my colleagues in the class then, when I told them, they couldn't even imagine what was going on in my head, what was going on in my mind. Anyway, I then put in an application, met with one of the professors then who had that project. And I could not wait to see her and have the first meeting with her. And it was in the course of the first meeting that I told her, I said, I would actually like to become an academic staff because I have been one in Nigeria where I migrated from. But in Australia, I don't even know what I needed to do. I did not know how I needed to work my way to the place. Could she please tell me what I needed to do? And then she told me about how I needed to have a particular GPA Then when I finish my Bachelor of Nursing, I can apply to do Bachelor of Nursing honors. If I get either first class and have some publication, or even second class upper 2-1, that I could go to do my Bachelor of Nursing honors. And then we go from there. And that was how I got connected. And I could say that I got the first person who will hold my hand and tell me how to find my way to the academics. That particular professor, interestingly, even was my principal supervisor for Bachelor of Nursing honors and principal supervisor for my PhD, and has been my mentor since then. Now, if I now look at academic life in a new country, completing my PhD could be considered as the beginning of another phase of the journey. And that is the other phase of finding myself among the academic staff. I was very excited, very happy as a mission, and considered it as like a mission accomplished. However, it was the beginning of another phase. And there was the issue of understanding the politics of academia. A number of us that are here will know that there is strong politics in academia. Politics in terms of whether you will be invited to projects, in terms of who will invite you to projects, invite you to, grant application or even to publication. And we know these are all scholarly activities that are specific to academic life. I had a lot of struggle in that area. And as a matter of fact, after completing my PhD in 2009 and being in academics since 2008, nobody actually invited me to any project, to any research. There was even a time when I had to go back to that my mentor supervisor and said, can I join one of your research project group or something? But I did not really get a positive response. My PhD specifically focused on health-seeking behavior and meaning of health for West African migrant women in Australia. So I could sense that was a research area that many people in my school were not passionate about, were not interested or particularly about. So it was a topic area that wasn't popular. In my school, you could get a lot of people working in area of diabetes or cardiovascular diseases or cancer care or things like that. But the specific of migrant and refugee help, it wasn't popular. So there was the politics of do we take her, do we not take her, trust, and all the rest like that. And I had to deal with that for years. I was, on lecturer level B for about 5 or 6 years to be specific. And what that then still suggested to me was not knowing what the academic environment was like. If I were to be in Nigeria, I knew what the politics was like. I understood what it was involved, and I knew what it would mean even to play the game in terms of knowing who to partner with, who are the academic staff, who is doing what, but all those were not clear to me. And that in itself was a big setback, which I believe many people who would have perhaps grown up here, who would have known the slang and the way to coin certain things or write certain application might not need to have dealt with. But that was my own experience. There was the issue of strategic approach to, dealing with the 3 key performance indicators in the university, which, we know in terms of research, teaching and learning, and engagement and governance. And my own experience was that I was lost in teaching and learning for many years with nobody to actually, and of course, nobody tapped me in the shoulder. Perhaps they thought I knew. And perhaps I thought I knew too, or I did not know. I was just doing, do you want to teach this subject? I would say yes. I was just saying yes to everything. And at the end of the day, it was about, I guess, drowning in marking, drowning in teaching and learning, which I love, which are very great and very important. But it would have been a different thing if I was researching what I was teaching, and if I was researching learning for my students. I would have gotten some publication and even grant application. But all that I could see or say there was ongoing fatigue dealing with, teaching the usuals of being in the class, but not, engaging in scholarship of teaching and learning. And that went, for about 5 or 6 years that I spoke to you about. And what that then yielded for me was that each time there was an opportunity to apply for level C or even grant application of teaching and learning, I was always thrown back in terms of I don't have enough research background and I didn't have enough scholarship of teaching and, and learning. But that was my story, not knowing how to strategically navigate, juggling these 3 key areas, all born out of being an academic staff in a new country, not knowing how things worked. There was also the issue of maintaining a work and life balance. And sometimes I look at it as work and life integration. I had 3 young children. They were growing up in Australia. As I was continuing in my journey, they were continuing in their journey too. In between, they became teenagers. In between, they were doing exams. In between, having to, walk around them. So how then could I have been able to juggle all those together and support them as well as support myself? But it was a lot of struggle. And if I look at myself as a woman, and if I had to compare myself, if my husband were to be in the academics, or even compare myself with a number of male academics, they were able to, submit application in a very timely manner. They were able to submit publications, grant applications, write papers a lot faster than I could. In instances why I had to struggle with even, getting a particular paper through or submitting a grant application, as a woman, that was a struggle. In terms of attending international conferences, where will we put our children? Or even my husband was working full-time in an accounting firm there. So there were a lot of decisions to make. And I believe if I were to be in Nigeria, I had my mother there, I had my mother-in-laws there. They could look after the children, even if I needed to travel overseas for conferences. But that was not, the case. So that went on. And adding to that was the issue of actual or perceived discrimination and racism. Well, many times there could be assumption to say that I was being discriminated against, or there were the issue of racism. People were saying it or even presenting it to me. But one thing that helped me was to see every turning down as opportunity to improve on myself. I made a decision not to allow the negative negatives that could be associated with discrimination and racism to set me back, but to see it as an opportunity to shine. So many times I used to ask questions, what would you like me to do better if I were to find myself in this situation again? And they would tell me, do this, do that, do this, do that, do this, do that. I'll do it, but when another opportunity come again, perhaps somebody that is even, relatively younger in the academics then will get the position. But then I kept on focusing on, remember I said it was a journey of determination and focus. So managing gender issues was another thing. Gender, and there are a lot of literature out there in terms of different ways in which women write when you compare with the way men write. Women tend to write in a passive tone, while men write in active tone. I've had to learn how to write in active tone along the way, but it was not without a number of, turning down. But I'm happy to have been invited to talk this afternoon, because my being where I am today is an indication of having overcome some of these things. I can say that I understand the politics in the academia more in terms of who is where and who do you talk to when it gets to what. In terms of if you need a particular thing, who do you call and through who can you get to who? All those are part of the corporate knowledge that I've gained along the journey. And also in terms of packaging my workload to ensure that none of the 3 key performance areas is lacking is part of what I've learned. And maintaining a work and life balance or integration has also come along the journey. I told you about a personal decision not to allow the negatives of discrimination to pull me down. And so it has been ongoing. And I'm glad, because when I was looking at what the previous speaker on this same platform spoke to you about, he spoke about, the issue of informal network. It worked a long way, even, beyond what one can think about. But I used to take the whole university as everything is formal. If you are turned down, it means you are turned down, it means you are not good enough, or you need to develop, improve on yourself. But I've come to know that sometimes the informal network also make some difference. So this one, I look at it as authenticity in connecting. Be genuine in connecting with people. There is need to connect. There is only so far that an individual can get to. And I'm very, very glad that a platform like this, Faces, is there, because I believe a lot of things would have become outcomes for a number of you that are on this platform. And I know that through even this, my coming here today, a lot of opportunities can also come for us in working together. So the issue of authenticity, identifying who you are and what you are passionate about. My research area was not a particularly popular one in my school, but it was an area that I was genuinely passionate about. Perhaps as a migrant woman myself, perhaps trying in any form, shape, or manner to be there to hold somebody's hand up as well as somebody held up my hands. I was genuinely interested in migrants and refugees and what it means to be starting all over again in a country where you have limited support, in a country where you do not know how things work, in a country where people assume you know, fair enough, assume you know, but genuinely and truthfully, you do not know how to get your way around things. So it's about being genuinely interested in who you connect with, genuinely and authentically, be interested in what you are passionate about, and coining out your own area of interest. Along the way of connecting, I've been working not only with academics in the university, I've got partners that I've been working in terms of researching with. And I thought it's a good idea to, showcase them, working in partnership with them, because these are agencies or organizations that are interested in what I'm interested in the area of migrants and refugees. I don't know which area you are interested in, but you too could find people that are singing the same song as you are and are passionate in the areas that you are passionate about. So along the journey of working with those partners, I've been
Olayide?
so okay. So having said that, it's a great area, still not popular, but it is in a great way, because today I can see myself, and I know, and I can describe myself as a leader nationally and even internationally when it gets to migrant and refugee women's health, and even specifically on female genital mutilation, because that is an area that is very new and very few people are in that space, and I'm in the leadership of that area. So as I begin to round up so that people can ask questions as they want to ask, I can say that my journey so far has yielded some important successes. I can direct you to my profile, staff profile in Western Sydney University. The journey still continues, and but I've got some successes to write on. You will be able to see my maybe my publication, some of my grant applications that are there, and of course awards that have come along my way. I brought this few in the, just looking at 2020, 2021. There are more than that, but looking at last 2020, 2021, these are important awards for me that have come along the way. And I just feel that I should also, project this, the importance of remaining connected professionally in career, in the journey to career success in the academia. Part of it is what brought me here this afternoon through Leah. Thank you again, Leah. And we met just, I think, towards the end of last month in Sunshine Coast at Council of Deans of Nursing and Midwifery Conference. So that was where we took these photos, we remained connected. And I feel I should also do justice that the young children that I brought in, 7, 5, and 3, they are all grown adults now. And the 7-year-old then is married, she's 30 now. And we are still together, still remaining connected as a family. I came here as 5, now we are 8. I've got my son-in-law and 2 grandchildren. And you may be wondering why it is important. The family is very important to me, in my career journey, because we started together. We have journeyed together and we continue to journey on. Thank you.
Thank you very much, Dr. Ogunsiji. That was such a brilliant journey, and hats off to your dedication. So you were an academic, you were a leader, and you were a voice for the refugee people who had no one could be raising their voice, and you given them a voice. Thank you so much for whatever you did. And I think we are a small group, so we can keep it all quite informal, and you're happy to take questions.
Yes, I'm very happy to take questions. Yeah.
So maybe I would ask the first question, Olayide, if that's okay. So tell me about the challenges that you faced in your leadership role, because I can see that you are chair for a lot of communities that speaks about women, and especially about African women. Was it easy?
Thank you very much. I wouldn't say it was easy, but every day was an opportunity to learn for me. I see every day as an opportunity to learn and to know people more. The African Women's Health and Support Organization that was established, it was a direct outcome of my PhD, because in my PhD, what came up clearly there was the underutilization of health services for African migrants in Australia. So I was looking for a platform to then raise the health literacy among those, among people of African background and women specifically. And so the initial thing was in getting to know people to partner with, who are the people that would be interested in migrant and refugee health. And that took me to connecting to the organizations that I connected to. And it was in the course of my connecting with them that I got, they saw what I had, they saw what I had to offer, invited me to be in their board. And within 1 or 2 years, I became chair. Very importantly, in terms of leadership, is the need to work with the vision and mission of the organizations. And I found out that the visions and the organizations, both the one that I was a founder, that I'm a founder of, African Women's Health and Support Organization, and Black Women and Girls Community Migrant Resource Center, they all align with what I was passionate about, which is to bring out the best and support migrants and refugees in Australia. So leading those organizations as chair, the challenge is that it will just open one up to dealing with many communities, dealing with many people. But I believe, and what has really helped me is the core values of respectful relationship with people, being culturally sensitive and mindful, and having an insight into what people are passing through, being the voice for the voiceless, has been what has helped me. So whether I say it is a challenge or an opportunity, many times when difficulties come, maybe in terms of, okay, if we look at this, the migrant and refugee space world in the first instance, it's a continuously evolving space in terms of the different waves of migrants and refugees. Currently, we are dealing with Ukrainians. And how do we deal? How do we understand them? How do we work together with them? But what I do is to come from what I know to what I do not know, and work in partnership with those that are from those core background, cultures, and communities in order to understand them more and provide optimal healthcare that they require and optimal settlement services that they will need. I don't know whether that answered the question, Abiba.
Oh, that definitely answers my question. Thank you so much. Anyone else has got any question?
A question, if that's all right, baby. Olayide, I guess what my question for you is, what would be the one piece of advice you'd give this group to move their research forward?
Work in partnership and collaboration.
Thank
That
you.
is the way. For many reasons. A paper that you will struggle to write and complete in 6 months can be completed within a month if you are working in partnership and collaboration with researchers like yourself. You can then allocate the task. You can motivate one another. Motivation is very important. You can motivate one another. You can pat each other on the shoulder, and you can have a collective story of accomplishments to tell. And many times in promotion, it's good that you can say you have achieved so much as an individual, but it will be very clear. I've read through some applications. It will be very clear that you will be struggling if you do not work in partnership or in collaboration with others. And also there is the space of who are you working with, either in mentoring somebody or in being mentored by somebody. So it's very crucial and very important for this group.
Thank you.
Thank you. Yeah.
That's an excellent piece of advice. Yeah.
I'll ask a question too, if
Thanks.
okay.
Yeah.
Much of what you said really resonated with me, Olayide. So, you know, I am also a migrant and came here not quite as a grown adult like yourself with 3 kids. But I came here and did my last year of high school. So in that aspect, I knew a little bit more about Australia before I plunged into academia. So a lot of what you said actually resonated with me. A couple of things, I have 2 questions. Hopefully we have time. One is, you mentioned a mentor in early part of your life as a student. You started as a student, you have a mentor. So I personally find that having mentor or mentors really important in people like us to navigate the system, to understand the culture and all that sort of thing. Can you give us can you give all of us here some ideas of what you look for in a mentor for someone like yourself?
Thank you so much. What I look for in mentor is somebody that is interested in, you know, being there to help me, to support me. You will find that there are different mentors for different things. Mentors for research, mentors for when you're applying for promotion, mentors in publication. So what I look for is, who are the people that I can read, that I, you know, I mean, one would be very unrealistic to think that every mentor would really like to see your face, kind of. We really like, let's just be, I mean, practical about it. Not every mentor would like to, I mean, maybe for whatever reason, want to talk to you or even have anything to do with you. Look for somebody that you relate with and will be happy to talk to you, and you can rub your mind and, you know, tell them exactly what you are looking for in them. Mentors that have the time for you. Some are just too busy to have time for you. And if you have a mentor that is too busy to have time for you, you will be feeling that you are wasting their time each time, and you don't feel good even to open your mouth to ask them. And also, they may have some insights in your research area, and they may not. But then they are happy to offer those generic ideas, be willing to read whatever thing you send to them, and even spend time with you. So that is very, very crucial. I'm a mentor to some people, and I have mentors too. Many times mentoring is important when it is informal, when it is not, okay, you know, very, very strict, only 10 minutes, 15 minutes, or it has to be every year or every month or something. something like something, make it informal, somebody who will just want to talk to you about anything. And I think people thrive in an environment like that. When they see, when they have people that can listen and say, I'm thinking of applying for promotion next year. And they say, bring it on, let's start developing it now. Not people that will say, oh, do you think you are ready? I don't think you can ever get there. You don't have all the publication. You don't have all the grants. You don't have all this, and they will all come with negatives. I don't thrive well with negatives, I think. Why I like those comments, but then it's good to look for mentors that have your progress in mind and they're genuinely interested in you growing, thriving, and progressing in academics.
Thank you so much, Olayide. And yeah, anyone else has got any question? So I might stop recording now.